is something so peaceful about watching a baby sleep. But as researchers and health officials have long been telling us, it's important to make sure that sleep is safe. But there is evidence that message may not be getting through in recent years. Despite more than a decade of telling parents not to bed share with their babies, Health Canada pointed to statistics that show as many as 1/3 of parents still frequently bed share. On top of that, Statistics Canada data published last year showed more than 90% of infants who died in their sleep between 2015 and 2020 were in an unsafe sleep environment. It's not always clear what role the unsafe sleep environment may have played in a baby's death, but some researchers say more should be done to make infant safe sleep a priority. Those experts include Dr. Ian Mitchell.
It has to be placed nationally as a priority, and it has to be placed much higher at a government level provincially.
CBC News asked coroners and medical examiners across Canada for all reports on incidents where infants under 12 months died in an unsafe sleep situation between 2009 and the end of 2019. We received information on more than 1,300 deaths. Only 476 contained detailed information on the baby's sleep situation, and of those, at least 61% were bed sharing.
Taking the baby into bed with you increases the risk. It's not a high risk, and most parents get away with it, but not all parents get away with it.
Health Canada recommends babies be placed to sleep on their back, alone, on a safe surface, like a bassinet or a crib, without any clutter around them. The guidelines say the risk of suffocation goes up when babies sleep with another person. The agency also says breastfeeding reduces the risk of sudden infant death syndrome, or SIDS. But even when parents are up and busy feeding multiple times a night, Health Canada says baby should go back to its own sleep space after each feeding. Dr. Rachel Moon has painful conversations weekly with parents who've lost an infant, and she believes many of the deaths are preventable.
They thought that it was okay because they had done it the night before. And if you've done it once and everything turned out okay, you're going to assume that it's going to be okay going forward. And that's the thing that the parents keep telling me. I wish I had known.
Moon says researchers need to better understand why parents bed share with their babies and then tweak their messaging. Health Canada issued updated safe sleep guidelines last year but stopped short of a public education campaign. The agency declined an interview request. Carissa Donkin, CBC News, Fredericton.